This is an educational video for patients who have been affected by having a stroke. This video should only be used under the guidance of a physiotherapist. We'll be talking about the shoulder joint in particular and how this can be affected after having a stroke. The shoulder joint is a very mobile joint, and we must be mindful of how unstable it can become after having a stroke. Sometimes when the muscles become weak around the shoulder joint, it can cause the ball, which sits inside the socket, to move more freely, and this can cause a partial dislocation, or in other words, a subluxed shoulder. This can be very painful for patients during the rehab process if not managed correctly, and it can also cause chronic pain in the future.
That's why it's important when handling an arm after someone's had a stroke that you position your hand under the elbow and on the wrist. And it's also good practice to put an upward pressure to prevent any further dislocation or subluxation. Also, when positioning the arm, try not to pull the arm or overstretch it, because that can make the pain worse and obviously cause further damage. This is a video demonstrating how to position a patient's arm following a stroke. This video should only be used under the guidance of a physiotherapist. It is important when in lying that you ensure that they are in good neutral position to make sure all their joints are aligned. Okay. There are two positions you can position the arm in lying, and it's good to have one or two pillows depending on the patient's position. I'm going to start with two. Okay, so make sure you position your hand under the wrist and elbow and bring it up into alignment with the shoulder. And I've used two pillows here, making sure it's a nice height. Okay. If this is not comfortable for the patient, there is another position across the body. So positioning the arm across the body, making sure the wrist is in a good position and the upper part of the arm has enough support. Again, making sure all of the joints are in a neutral alignment.